So we see an awful lot of shoulder injuries in physical therapy. The most common shoulder injury would be rotator cuff injury, classified typically as pain kind of on the outside or maybe front of the shoulder, and sometimes can radiate down to the arm. Like normal for me, treating a shoulder injury like any other injury is somewhat sort of simplistic if you're just focusing on the symptom of pain and inflammation. Common treatments such as massage, dry needling, Grasson technique, and different stretches, even exercises specifically for the rotator cuff are oftentimes used. And these are great ways to help to reduce the pain, the inflammation, and get a client feeling better early on in the process. But most of the time, I would say, probably 85% of the shoulder injuries that I see that are rotator cuff related are mechanical dysfunctions. In other words, it's not just an injured rotator cuff that is the problem. Usually it's a problem with the way movement at the shoulder is coordinated. So oftentimes when I see someone with a shoulder injury, I'm looking beyond just the shoulder itself. I'm looking at the relationship of the other joints and muscles that are involved with movement and use of the shoulder. Those being the scapula or shoulder blade and the thoracic spine or the upper portion of the spine. The most important thing typically is the thoracic spine. By addressing the thoracic spine, we're setting the shoulder up mechanically to work most efficiently. Even if we have a situation with a diagnosis of what you may have heard of as dyskinesia of the scapula, that still comes back to coordination and control of the thoracic spine. So as a quick example, if you look at me standing in a good postural position and you look at the position of my neck and shoulders, that changes dramatically when I change the postural position of my upper spine or my thoracic spine. So if I allow my upper back to kind of slouch forward or flex forward, you can see that my head moves forward and my shoulders move forward, which greatly affects the ability of some of the supporting muscles around the shoulder blade and the shoulder itself to function naturally. So with this type of an issue, if we just simply treat the inflammation or the symptoms of the pain, we can have temporary improvement without long-term resolution. So looking at the thoracic spine is usually the first step to resolving shoulder pain. Let me show you a couple different exercises that we can use to address this. Okay, so a couple of exercises that we will usually start with in order to treat a mechanical dysfunction at the thoracic spine, which would have an effect on the shoulder, resulting in shoulder pain or rotator cuff tendonitis problems, would be to look at the thoracic spine mobility. We want someone to go from being in a flexed posture to having the ability to get in a more extended posture at that thoracic spine to help to align the shoulder. But if they lack the mobility at the thoracic spine from being in this position for an extended period of time, the first thing we'd have to do is improve the passive mobility of the thoracic spine. So one of my go-to stretches is what we call an open book stretch or a windmill stretch. What I have people do is lay on their side, like I have Ren here. We have them flex the knees up so that the hip is about 90 degrees. The key to the exercise is to make sure the knees stay stacked. The top knee should not come up away from the bottom knee. And then also to make sure that the knees stay flush with each other. So you want the top knee to be even with that bottom knee. Oftentimes what will happen is when someone's rotating the thoracic spine, especially if they're real tight, they'll let the pelvis kind of come back, which means the knees either come apart from each other or the knee will no longer be flush with the other knee. So what we want Ren to do as he comes into that position is to kind of think about taking his pelvis and kind of pushing that pelvis forward in order to keep the knees together and from kind of sliding back on that bottom knee. And then while he holds that pelvis pushed forward, he's going to rotate the spine and try to bring his shoulder to the floor. One of the common areas of feedback I'll get from patients is when they're reaching back with the arm is they'll complain of feeling stress in the front of the shoulder or more of a stretch there than they're feeling in the back. So the point of the exercise is not to reach for the floor with the hand per se. It's really to rotate the spine. So if someone just can't seem to get rid of pain in the shoulder as they'll do that, what I'll have them do is take the top hand and hold the opposite shoulder. Now I'll have them rotate back. This way, they're really thinking more of the rotation happening at the spine. And then once they begin to feel the stretch in their upper back, then I'll have them take and extend the arm out. And you'll recognize that the arm is just kind of acting as a little bit of a weight to help to kind of rotate the spine a little bit more. With this stretch, I tell people they hold for somewhere between 10 to 15 seconds. I like doing 4 times on each side. Oftentimes, I find the more repetitions you do in this one, that spine will start to loosen up and move a little bit more easily. So you're going to come back and rotate Ren and hold 10 seconds, maybe 15 seconds. And the focus of the stretch, again, is sort of in the back, more toward the upper part of the back. So this is an example of a passive stretch to help to improve the mobility of the spine. All right, and the next exercise we do is more of an active mobility exercise. This is where we're starting to work on the awareness, the control of that of that rotation. Rotation of the upper back is directly related to your ability to extend the upper back. A lot of times rotation is a little easier to coach than extension, especially if someone doesn't really have that understanding of how to use that area. They haven't been able to use it much on their own. So the setup would be having a client sit back on their heels, knees together. I tell people to imagine a straight line going up in between their knees, and one hand's going to go on that line. There you go. Opposite hand will go on that opposite shoulder. Let's go on the shoulder. And then what I'm going to have Ren do is rotate at the thoracic spine. So the key to the exercise is, as he rotates, is to think of the rotation happening in that mid to upper spine. Some of the common mistakes I'll see with this one is that someone lacks mobility at that upper back. What they may try to do is side bend, so they feel like they're getting more motion. Or they might shift their hips side to side, which makes them feel like they're getting more motion. So oftentimes I'll use a cue and tell someone to imagine they're inside of a tube or a barrel. All they can do is rotate inside the barrel. There can't be any side to side motion. And then I'll just try to cue them and say, you want to try to feel the rotation happening in the muscles right in that upper mid portion of the back. Now, Ren's doing this one with his hand behind his head. It's a little bit of an advanced version of the exercise. So if that creates stress at the shoulder, or you're having a hard time getting a good full range of motion, having the hand on the opposite shoulder would be a more remedial way of doing it. It'll allow you to isolate at that thoracic spine a little bit more. By learning how to rotate at the thoracic spine and gaining some strength and control there, that's directly proportionate or going to assist your ability to get into that thoracic extension. Another exercise that I'll often use is to help someone start to learn the actual skill of extending the thoracic spine. Now, anytime we're working with someone who's at the remedial stages of learning how to move, we always start them on the floor. We're eliminating the resistance of gravity from the equation, and oftentimes the floor can provide them with some feedback so they can really feel if they're getting the right technique. So in this exercise, we're literally going to practice extending the thoracic spine, or basically going from this flexed and rounded position to a flatter thoracic spine. Because as we said, that position helps to realign the scapula and the shoulders into a better mechanical position. So with this exercise, all I'm going to have Ren do is lie on his back with his knees bent, and we're just going to practice extending the thoracic spine. The cue I'll give to people is just to think of lifting your chest up to the ceiling, and it's done properly. You should feel your shoulders move into the floor and the muscles right in the middle part of the upper back engaging to extend that part of the spine. Once I have someone who shows me that they can find that position, then the next step is we'll add a little extra muscle activity by having them press lightly with their elbows and backs of their arms into the floor. So I will have Ren just kind of push back into the floor. Now, if someone does this, the key is to make sure that when they're pushing back on their elbows, they're not allowing their shoulders to pop up off the floor. So Ren, if you push real hard with your elbows, you'll start to see the shoulder begins to kind of come up away from the floor. So he's pushing too hard, or he needs to have a better focus on keeping the spine in that extended position so that the shoulder doesn't come off the floor. So Ren, let's try that again. Extend the thoracic spine first. Then you're going to pull your shoulders and elbows gently into the floor. And what you should feel are muscles all in that upper back, from shoulder blade to shoulder blade, as well as kind of in the middle part of the spine, engaging to extend the thoracic spine.